Hi, so today we'll be taking a look at the axis, which is the second vertebral bone in the vertebral column. So this is the axis of a horse or an equine. So let's get started. We'll go from cranial to caudal, so it's easier. So first up, most cranially of the axis, we've got this portion over here. You see this area over here? That is called the dens. So the dens is the most cranial part of the axis, and it's the part that articulates with the fovea dentis of the atlas, which is the first cervical vertebrae. Next up, we've got the processus articularis cranialis. So if I put it this way, you can see that it's on both sides, of course, and it articulates with the processus or the fovea articularis caudalis of the atlas. So there we have it. Next up, we've got the foramen vertebrale laterale. It's this pretty big foramen over here. So in practical exams, when asked to identify, you would normally put a pin or pass a small wire through it so you can get an idea of what it looks like. So ideally you would take something and pass it through, and once you do that, it would lead straight into the foramen vertebrale, which is this big a big foramen vertebrale. This is where the spinal cord will pass through. So once you take it from out to in, you would pass it through the foramen vertebrale, and that's how you can identify that it's your foramen vertebrale laterale. How I like to think it is foramen vertebrale, okay, and well, it's a foramen of the vertebral, and laterale because it comes from the side. So when you move outwards, we all know when you move from out to in, you go from lateral to medial. So that's how I like to think of it, as foramen vertebrale laterale. Then we've got the processus spinosus, which is this very prominent structure dorsally on the axis. So if I shift it this way, you get a better view of it, what it looks like dorsally. Okay, so you can see it's a pretty big processus spinosus. And in horses, to identify the species if asked, you can easily notice that it's got, if I put it this way, you can see better, it's got two branches over here. It's got two wings at the end. So that is your cranial side. This is your caudal side. And in horses, it starts together and then it divides into two pretty big wings. Next up, we have the crista ventralis. So that is the complete ventral portion of this bone. So over here, you've got your crista ventralis, this entire crest over here, crista ventralis. Next up, what do we have? The incisura vertebralis caudalis. Okay. So here is your incisura vertebralis caudalis over here. This is what it looks like, incisura vertebralis caudalis. Okay. So normally when you have a complete cervical vertebra attached to it with the with the atlas axis C3, C4 and onwards, you've got, when you have the C3 over here, say it's here, it forms what's called the foramen intervertebralis, basically a foramen or a hole, or a gap rather, which is formed in between two vertebrae. So foramen intervertebralis over here. And this is what it looks like because of this incision over here on the incisions of the rest of the vertebra of the cervical vertebral. You would see the incisura over here, the incisura vertebralis caudalis over here. Next up, we've got the foramen transversarium, which is a pretty small foramen. In the atlas, it's much more prominent. So you can see this tiny hole over here. This is your this is your foramen transversarium, this part. Now, when you pass a wire or a small pin or something through this, it will directly lead you into this, which is called the processus transversus. Now this processus transversus, you can see it from the top as well. It's a protruding on the lateral side of most, not just on cervical vertebrae, but also on the thoracic vertebrae and even lumbar vertebrae. Two main parts you need to identify would be the processus spinosus over here and the processus transversus, which is these two on the side over here. Next up, we've got the processus articularis caudalis, which is this most concave body, and the caput, or the head of the third cervical vertebra, would articulate with this part. So there you have it. These are all the parts you need to know for the axis. So you start here with the dens, the processus articularis cranialis. Then you have the foramen vertebrale laterale, which is this pretty big foramen. It's on both sides over here, this one and this one. In between, you have your foramen vertebrale. This is where the spinal cord would pass through. Next up, we have the processus spinosus over here. And in horses, it's divided into two branches like this. Then we have the crista ventralis, which is the most ventral crest over here. Laterally, that's how it looks. It goes caudoventrally over here. Then we have the incisura vertebralis caudalis, which is this incision over here. So I'll just flip it this way. You have it here. This is what your incisura vertebralis caudalis looks like. Next up, you have your foramen transversarium, which is this tiny little foramen. It's much more prominent and visible in the atlas of the horse. So this is what your processus transversarium looks like. And once you pass something in through it, like a little wire, you can pass it through, and that would lead you straight into the processus transversus over here. Then we've got, lastly, your processus articularis caudalis. This is the concave body, or the most caudal and most concave body of the axis. And this is where the caput, or the head of the cervical vertebrae would articulate. Thank you.